Well, good afternoon, everyone, and welcome to today's discussion, which is going to be all about the menopause. I'm really excited because I've got Katharine Gale here with me today. And for those of you who know Katharine, you know what a gorgeous energy she's got. She's just lovely, calm, kind energy. And for those of you who don't yet know Katharine, you're going to find out all about that lovely energy as we go through the call. So Katharine is a menopause expert, and I'll let her talk about her background, but I wanted to really emphasize the fact that her background is a clinical background. She's been working in women's health for a number of years in a clinical environment. So it's not as if she just picked up a book one day on the menopause and decided she was an expert. She really has got genuine experience in the field. So having said all that, what we'll do is we'll spend a bit of time finding out more about Katharine, getting her to talk about what she does and why she does it. And then we've collected some questions from various interested parties, ladies who are contemplating the menopause or actually going through it. And Katharine's going to answer those and anything else that she thinks we might need to know about. So without further ado, welcome, Katharine. It's so good to have you here today.
Oh, thank you for that opportunity to talk to your community.
Yeah, I'm there. I know they're looking forward to it. A lot of excitement in the questions. So why don't we start with what is it about what you do? Why do you do what you do? What gets you out of bed? Why do you do what you do?
So it's all about empowering women, empowering women to understand their bodies and to know their mind so that they can make choices about how they want to navigate through their life, and in particular around midlife. And so I've always had an interest in women's health. So I've worked now for 30 years as a nurse consultant and working always around menstrual health and about menopause, including fertility as well, and the challenges that that brings. So it's those life events that happen through women's life. And what I find is that there's a lot of shame around some of the things that are normal. So particularly around pregnancy loss and miscarriage, around periods and menstruation, and also about menopause. And I also find that some of that shame comes through a lack of knowledge and understanding, and a fact that we've sort of over the years sort of passed over the responsibility for our bodies and the knowledge and the wisdom to those in the power, so medical colleagues and things like that. And really what we failed to do is really stay connected to ourselves. And so for me, it's about helping women to reconnect with their own bodies and what's normal for them, but also then to take some understanding of the challenges that life throws us, and know what options are out there so that they can choose what's right for them. Brilliant. That's what I really want to do, is just empower women to make choices that work for them.
Brilliant. And I know that you're, as well as being having been a nurse consultant, you're also a qualified coach. So what is it that you do? Tell us about that.
Absolutely. So what I will do is I work with women in midlife who are in a state of flux, that suddenly they have become aware that things aren't going to plan. Maybe there's a decrease in energy. Maybe their mood is starting to change. They're finding it difficult to make decisions. Sleep is impacted. And what I found is that I was seeing women in my clinics and we were talking about HRT, and they really didn't have the knowledge about HRT and what other options there were. And that made it really difficult for them to make a decision about what was right for them. Yeah. And so I felt that I could have a much greater impact if I was working almost on the outside of the NHS, speaking to women before they started seeking help, and raising awareness of what the changes are so that they could spot the signs. And then knowing that HRT is not the only answer. There's lots of other things that women can do, including lifestyle changes, the way we feel and about the menopause. And I wanted them to be able to seek help and support and get the information they needed. And so really what I found is that the coaching actually really helped women, because they know deep inside what they want to do. It's just they don't know where to find the information that's reliable and easy to understand. And so being radically simplifying information for women is one of my values. I want to take what seems as really complex and help them understand that information and make a decision that they're confident in, and then they can ask for help. And so I haven't gone down the route of, although I'm a nurse prescriber, so I understand so much about HRT and the medicine and how it works and the side effects and what options there are. I haven't gone down that route because I feel really strongly that I want to empower women to ask for what they need from healthcare professional that they're going to be having a relationship with over the next coming years. They may be altering their medication. So the coaching works in a one-off session I do with women sometimes, looking at what their challenges are, what are the symptoms that they're struggling with, and what are the approaches that they can take, and then helping them to make a decision whether they want to go down the natural route, whether they want to try HRT, or whether they want to look at their lifestyle and make some choices around the work they do, the relationships they have, or just self-care.
Right. Brilliant. Yeah, it's so interesting because so much of what you're saying is exactly the kind of things that have been raised in the questions that people have posed. So one of the questions, and it did come up as a question, but it'd be great to hear your take on what is the menopause? We talk about it. What goes on? We know that hormones collapse, but what really goes on?
It's amazing, isn't it? Because it's a natural event that's going to happen to all women, whether that's through surgery or whether that's naturally. And yet we don't talk about it. We don't know what's coming up, and we're not really quite sure what the symptoms are and when it happens. So the menopause itself is a retrospective diagnosis, and this is what makes it challenging. So only when you've gone through the menopause do you realize that you're menopausal. Yeah. And actually the difficulties that women sometimes experience around the menopause is leading up to that point of time. So we say you're menopausal when you haven't had a period for 12 months. And so that's that retrospective diagnosis. And then we're starting to hear more about the perimenopause. And the perimenopause is when some of those symptoms, and there are around 34 symptoms of the menopause.
Oh my.
From physical symptoms like hot flushes, night sweats, palpitations, to the psychological ones that we don't often talk about, the anxiety and the low mood and the rage and the mood swings, and then to some more intimate ones like breast tenderness, vaginal soreness, lack of libido. So a whole range of symptoms. And sometimes it's difficult for women to join up the dots because what one woman will experience will be very different to another. So that perimenopause is when our hormones start fluctuating, and it's that fluctuating of the hormones that actually causes the symptoms. Right.
And so, it's so it can be very individual.
Absolutely. So, I mean, 25% of ladies will sail through it. And aren't they lucky? I wasn't one of those.
I was, but then I took the Chinese herbs.
Absolutely. And this is what it is. There are different things that work for different people. So I quite often find a lot of the women come to me and want to go down that natural route first. So there's some strong evidence about sage and black cohorse, for example, red clover. There's some strong evidence that for some women they can help with vasomotor symptoms. So the vasomotor symptoms are the night sweats and the hot flushes. They don't tend to work so well for the psychological ones like anxiety or low mood.
Right.
And so it's just worth women knowing that. And some women will find they work really well very early on when they've still got a little bit of their own hormones from their ovaries. And then as the decrease in hormones happen, they sometimes find that that's not working for them. So things like soya, you would need to take a huge amount of soya in order to have a benefit as your symptoms get more severe. But for me, I had anxiety first, and that I didn't put down to the perimenopause. I was 40. I had a young son. He was only 18 months old, and I wasn't sleeping, had terrible insomnia, and that led to a fatigue. And I really thought that it was all linked to work and not enough energy to for myself, for my son and my family, and for work. And so I actually walked out on my job. And so part of the perimenopause is helping women to understand they're normal changes and the impact it's having on them, and helping them to join up the dots, because for one it might be anxiety, for another it might be sleep, and for someone else it might be palpitations.
Right. So one of the, we're kind of dropping into the questions, which I said we'd do at the end, but it all fits together. So one of the questions that we had was, somebody asked, I've no idea what happens to the 4 stages of the menstrual cycle. Do the hormones all disappear, or do the stages of the menstrual cycle disappear, or do they remain and their length changes? Do we end up with any feminine hormones whatsoever at the end of it?
This is a thing, and I tend to talk to women about the life cycle. So, we need to understand our periods to understand pregnancy and fertility, and then to understand the menopause. And yet so few of us really understand what's going on in the menopause. So you have 3 hormones. You have estrogen, and you have progesterone, and you have testosterone. And we actually have 3 times as much testosterone as we do as estrogen. And this is the hormone that in our 20s and our 30s means that we play hard, we work hard, we've got lots of energy, we've ability to have this laser focus, lots of energy. It helps us with our metabolic rate, it helps us with sleep. And then all of a sudden that slowly starts to decline in our late 30s and our 40s. And that's why women have a higher increase of anxiety, that inability to focus, poor sleep. And so that's a really important hormone that we very rarely talk about. It also helps with our testosterone. Yeah, and it really helps us with our muscle bulk as well. So, that's a hormone that women don't often talk about. And so that gradually declines. Men's testosterone declines as well, but at a much slower rate. And then we have estrogen and progesterone, and they play a really important part. Mostly estrogen is the one that when it starts to decline, we have most of the symptoms linked with that. And that's why we talk about replacing that in most cases. So for women who have had their womb removed, they only need estrogen. And so that makes it a lot easier. Whereas women who have a womb, we need to take progesterone as well. And that's to protect the lining of the womb against over thickening and potentially cancer. And that's why those 2 hormones are really important.
Oh, so what then is HRT exactly? What is that, a combination, or are there different forms? How does that work?
And this is what makes it really complex. When women go to the GP and say, I want to take HRT, actually there are so many different types. And it can be really confusing. And sometimes if one doesn't work, there are other options. So I always say, it's very individualized, and don't get disheartened if the first time you try something, it doesn't work, because there's lots of options. So for women who have had a hysterectomy, for example, we would give them estrogen. And we would give that either as a tablet, as a patch, or a gel, or even a spray. So there's lots of different options there. And all estrogen is body identical. So available on the NHS, very similar to what we have in our own bodies. And so it seems to be tolerated quite well, although initially you can get some side effects. And then you can get HRT that is combined, so either as a tablet or as a patch. And then there are different types of progesterone, and this is where side effects can be linked with that, and bleeding problems can occur if we're not quite on the right progesterone, because you can have it as a Mirena coil, for example. You can have it as a combined patch. You can take it as a tablet, and there are synthetic types and there are natural types as well. And some people say, I only want the body identical progesterone. But actually, for some women, they're going to need the synthetic if they've had heavy periods, for example, because it's really good at period control. So what tends to happen is you start to get these fluctuating estrogen and progesterone, and it means you don't always ovulate each month, which means you get a longer cycle. And so you can start to feel a less sort of normal pattern to your cycles. And some months you're going to feel okay, because you've ovulated and your body's in sync. And then the very next month, you might find that ovulation doesn't happen. and your follicle stimulating hormone increases, and it's that causes the hot flushes, the night sweats. And then as soon as you ovulate the next month, you might start to feel a little bit better. And so it's this unpredictability of it that makes it hard for women to join up the dots.
So the follicle stimulating hormone, that's the one that stimulates the egg to pop, as it were.
Yeah, to ovulate,
But it's working its magic, but no magic's happening because there's nothing to happen.
Absolutely. We've got a decline in the number of ovaries. And I almost talk about the ovaries start to become a little bit deaf to it. So they don't respond all the time. And the follicle stimulating hormone needs to sort of shout at the ovaries and go up and up and up. And it's that raised follicle stimulating hormone that when people do have blood tests, that's what we're looking for. It's not always appropriate to do hormonal testing, but when it's done, that's what makes it a little tricky, because it can alternate in different months. So you can have it high one month and low the next, so it makes it quite unpredictable.
Oh wow, gosh, that is so interesting. So many things that, well, I guess I didn't have to know because I had a smooth menopause. But so many things so many things you say that we just don't know. And I was reading a book recently. It's about the vagina, basically. And they talk about issues that, like, itching around the vagina and things like that, which are associated with the menopause, which we don't tend to hear about very much.
That's right. The skin is really affected during the menopause. Lots of ladies talk about dry skin, and you get dry skin in the vagina as well. It becomes very thin. It lacks in collagen. So we tend to find ladies have maybe painful intercourse. They may find they actually just have some sort of shooting pain or burning pain in the vagina and the itchiness around the outside. And also it's linked with recurrent urinary tract infections as well. So vaginal estrogen, it is very easy it's going to be in September, it's going to be available over the counter for the very first time. We've worked really, really hard to help women get access to this because it's such a low dose of estrogen. It's not like taking full on HRT, not linked with the same risks, and it works locally on the vagina. And so it's going to be available on the over the counter, and it can help women with urinary tract infections. It can help, say, if people have painful vaginal examinations or painful intercourse. It can really help the vagina. So and if you don't want to take hormones, or you can't take hormones, things like vaginal moisturizers and lubricants, there's lots of different options, and we just don't talk about it.
Yeah, it's such an important conversation to be having, and to be having before you ever get to the menopause.
Absolutely. And some women, find that that's one of the first symptoms that they get. They start to notice they've got just current UTIs and they haven't had them before. And for some of those women, they might even be taking HRT, but it's not getting where it needs to get to. So we just give them a little extra dose. And for women who are worried about it, the dosage is one oral contraceptive pill. The dose in that is equal to a year of vaginal estrogen.
Oh, right.
So, I mean, it's minimal, absolutely really minimal.
It's almost homeopathic.
Absolutely, yeah.
Right, brilliant. All righty. Well, I think we've kind of pre-answered quite a few of the questions, but let's have a look at the questions and see if there are any that we haven't covered off. So there's a great one from Sinead. Is there anything young ladies can do now to help make menopause or perimenopause easier when it eventually comes?
Do you know what? This is one of the reasons I created Fluxstate. So before I started coaching women, before I set up my business, I set up a Facebook group, and it's a private Facebook group, and we've now got 2,000 women in there. So I really feel strongly about community and connecting with other women. Yeah. And that's what Fluxstate does. So it's about us talking about the menopause. It's open for any woman who wants to know more about it. And we share the symptoms that they might experience. So being aware of what the symptoms might be in advance really helps you join up the dots. And it helps us to normalize the menopause and share that you're not alone, that you're not going mad. There are other people who've got similar situations to yourself. So I quite often find the women are really supportive. So find yourself wherever whatever it is, find yourself a community of women where you could talk about the menopause and normalize it. Find out more information, ask advice and get support. That's one of the things that I think has had the greatest impact for me, was finding a community where we could talk.
And I think you have a report, an ebook about the menopausal symptoms, don't you?
Yes. So about a year ago, one of my coaching clients had a symptom of the menopause, and it was burning mouth syndrome.
Oh.
Really bizarre, I know, but it's one
Who
of
knew?
the who knew? It's one of the 34 symptoms, and I've got quite a few ladies in my community who have it. And it's this burning sensation that can be triggered by things like hot food, hot fluids, and it really feels like their tongue's on fire. And so I thought, do you know what? I wonder how many other people know about burning mouth syndrome. And so I wrote a post in my community, only to realize there were quite a few people in there who had it. And then over the next year, I wrote a post on all 34 symptoms with some sort of triggers, information. And what I've done now is I've brought it together in an ebook that's just free for anybody to access on my website. So that would be www.fluxstate.co.uk, and you can download it. And it's been beautifully designed and edited through Sarah Price and Fiona Loverty was my editor. So I'm very proud of it. So the more people that can get into the hands of and really help women to understand the symptoms, I think is going to be, it's empowering, isn't it?
Yeah, absolutely. That's brilliant. And we'll put the link in the notes for the notes for the show, as they say.
Exactly. I think one of the other things that we don't talk about is that there is research that women's experiences of the menopause is based on their previous physical health, their social situation, maybe their cultural paradigm, their family's experience, their mothers, and also whether they've had, depression before, or anxiety, or say premenstrual tension, for example. And what we know is that women's views of the menopause can really influence their symptoms. Wow. And this is, I'm trained in cognitive behavioral therapy. So I do a 6-week course with women where we really look at their perceptions of the menopause and help them to understand their thoughts and feelings and how it affects their symptoms. So there's strong evidence that cognitive behavioral therapy reduces the severity and impact of things like anxiety, low mood, sleep, hot flushes. So for women who can't take HRT, for example, somebody who might have had breast cancer, actually realizing that they can be in control of their symptoms and actually having a more positive perception of the menopause, knowing there are things they can do, can really help women's experiences of the menopause. So I think if you're dreading the menopause, having seen Davina's program and hearing everybody share their story, one, not everyone like yourself goes through a menopause that's traumatic. It's only about 25% of women that have severe symptoms. The majority will be 1 or 2 symptoms they struggle with, like sleep, anxiety, or hot flushes. And things like CBT can really help.
Brilliant. And diet and exercise, do they play their part in sort of ensuring that you're healthy as you roll into the menopause, into perimenopause?
Absolutely. I feel really strongly that we need to be talking to people about lifestyle changes. So we know the triggers of hot flushes, for example, alcohol, caffeine, those sort of things. So looking at the stimulants we might have in our diet and just being aware of what triggers us, so that you can then say, actually, I'm going to cut down on that. Smoking, for example, can increase hot flushes as well. So those are things that we can look at and will have huge benefits as we get into our older age. And then things like diet. So I'm not a nutritionist, but I've got some great people in my community, Lolia Harrison and Sally Moorcroft, who's a functional GP, who really advise the women in my community around nutrition. But we can look at what choices we make around food.
Right.
So we can look at, I always say, start with food and what you're choosing. Look at the symptoms you might have and make choices like things like you can eat more beans. and pulses. You can really look at your iron intake if you're struggling with fatigue, and really look at that first before you start thinking of things like supplements and adding in what you might not need really.
Right.
And then exercise. If we think about exercise, we know women's bone loss starts to decrease in their 30s and 40s. And we know things like weight-bearing exercise helps us to strengthen our bones. So things like running, cycling, and even walking can really help us. So increasing our movement in our 30s and 40s can really help. And, you know, going forward as well.
Yeah, sure.
And then it's really important, because testosterone drops, we need to be thinking about our muscles and strengthening our muscles. So things like using some small weights can be really helpful. That's going to protect our bones. And we are at risk of osteoporosis. 1 in 10 women will struggle with that. And that was what causes, you know, the fractures people get in their 60s, 70s, and 80s. And so things like strengthening our muscles is really important. And then the other thing is, we don't want to be falling, because if we fall, we're likely to fracture. So things like flexibility are really important as well. So yoga, Pilates, and that also helps with our stress and our well-being as well. So really, you know, it's not rocket science, but it's all the things we've been talking about, but we don't link them with the menopause and healthy living in old age.
Yeah. Great. Thank you. So there's another question from Kathleen, which is pretty much the same question. Feeling stressed about 44, stressed about the thought of it. Yes. Can we prepare? You've just said, how do we know it started? And from what you said, you can't always tell.
No, it's difficult to join up the dots. So, you know, most women will be in their 40s, but 1 in 100 women, it will be before 40. So it's really important that we're aware of that. And I really it's yes, hot flushes make it easy if you've got hot flushes and night sweats. There are other conditions that cause that, so we need to rule them out. But if you've got other symptoms, it's joining up the dots and being aware of them that can help you identify whether you're perimenopausal or not.
And your ebook can certainly help them with that.
Absolutely.
Nikki is asking, what are the top foods and supplements to take to ease way through the perimenopause and the menopause? Things to avoid. Kind of covered that, but I don't know if there's anything you want to add on that one.
Yeah, so the calcium's important. So looking at what calcium we have in our diet, there's so many of us that have taken dairy out our diet, and we just need to make sure that we're getting enough calcium, because that's what's going to give us strong bones and it supports nerve function as well. So and with 1 in 10 of us having osteoporosis, that can be important. So if you're not getting it in your diet, that might be where you want to talk to a nutritionist about increasing your calcium. Other things that can really help, things like magnesium. So magnesium helps with sort of regulating our hormones, and it also helps with reducing cortisol levels, so that stress hormone that we get. It helps with insulin as well, regulation, and thyroid hormone as well. So when women start talking about things like sleep, low mood, weight gain, we hear that so much in the menopause. Actually, sometimes our magnesium levels are not high enough. And so foods, I would say greens, beans, and nuts are the ones that you need to be taking for magnesium. But you can also get things like, ladies who are struggling with sleep, you can get sprays that you put, magnesium sprays or creams or lotions as well that help. So that's one area. If ladies are starting to have heavy periods, which is quite common, particularly if you're not ovulating every month, you get an over thickening of the lining of the womb, which causes heavier periods. So that's why women get it, and they can then become anemic. So and the anemia is linked with things like hair loss as well, which people don't realize, and fatigue as well, and a bit of anxiety, maybe some palpitations. So looking at that can be really helpful as well.
Brilliant. So that covers, I think, pretty much what Monica's question about diet and exercise.
There was something she said, but there are things to avoid during this phase of life. From personal experience, I would say avoiding burnout and overwhelm. really recognizing our energy levels around this time is really important, because what happens when our decrease in testosterone goes is that the hormone we end up using is adrenaline.
Right.
And that adrenaline is what it burns us out, and it causes us, one of many talks about being superwoman, trying to do it all. And what I would say is, if we can avoid that, then that's going to help. So, because this is the time to start making choices. This is the time to start saying no. This is the time to start saying yes to some things that you want to say yes to. And if we're not really understanding our energy levels, then it makes it really hard. We end up pushing through, and that's what causes that. So if there's anything I would say to women, is tune into your energy levels, because as you go through the perimenopause, your energy level changes during the cycle. And so if you're always expecting yourself to have the same amount of energy, even on little sleep, then that's going to be a cost to your health and well-being. So that would be the thing I would encourage women to avoid.
What happens to the post-menopause? I mean, when we've stopped, the years gone by, there's not been any periods. What happens? Do the hormones and the phases, the phases of the cycle disappear, or what happens?
Yeah, so gradually over time, our hormone levels drop. And for a while, follicle stimulating hormone stays high while it's trying to get the ovaries to release more estrogen. And then over time, when our periods stop, the estrogen remains low. However, we can release a natural estrogen from our body fat. And so it's called aromatization. So we release it from our body fat, and that can stimulate the lining of the womb a little bit. So it's really important women are aware of, if they suddenly start getting a period again, or a bleed, or even a brown loss, that they seek help, because it might be this natural estrogen they're producing. It's a little weaker, but it can still stimulate the lining of the womb.
Right.
So what happens is we tend to get used to the low hormones. So for most women, the hot flushes and the signs and symptoms of the menopause that have been impacted them start to tail off. A few women will continue to have hot flushes into their 70s and 80s. So we must be aware of that. But on average, it's 4 to 6 years that women will have symptoms. And that's where, because we've got a hormone deficiency, that's where we have some of the impacts of that long term. So things like bone health, heart health, and our brains. It can be that it's that decrease. But for most women, they won't have the symptoms. They'll learn to get used to that, but they will still have changes in their energy levels. So Dr. Joanna Martin talks about it almost like a shadow cycle that stays there. Right. And I know women talk about this. They'll go through periods of time. It's slightly longer cycle, can be with the moon. It can be, I don't know if this is, true or not, but I do know women talk about that they still feel they have different levels of energy, whereas men seem to be much more stable.
Yeah. I certainly, I mean, I'm way past my menopause, but I'm certainly, there is something about the moon.
Yes.
There are times in the phases of the moon where I'm lower energy, and times when I can almost feel the moon.
Yes. Yeah. Before you even see it,
Yeah. Like, oh, okay, I'm feeling like that. Oh, right. Yeah, the moon's full. Yes, that makes sense.
Yeah, absolutely.
And it wasn't in the original question, but what about woozy brain? Because a lot of women do talk about brain fog.
Yeah. So the testosterone really helps us with that laser focus and memory. So that's why we start to notice that we need to write more lists. I'm a big list maker. Lots of women become this. Lots of women will say when I'm talking to them, I need to write that down because I won't remember it. And you forget things like the names of people you know really well, or you forget what a hairbrush is called when you're trying to find it. It's those sort of things that we tend to notice. So we know that the brain does go through changes. And actually men have some changes too, but they're not so noticeable. Right. So the brain fog can be an issue, and I think it's just understanding that and finding ways. Lots of women say, I thought I had dementia, and that's a very different diagnosis to just brain fog. So if you do have concerns, it's always worth talking to your GP. But it's finding ways of learning how to manage it, really, and treating yourself with a bit of self-compassion. We all forget some things. So, if you need to write a list, you need to write a list.
Indeed. And finally, a question from Kirsty about sleep. Any recommendations around sleep?
Yes, sleep is one of the things I hear a lot of ladies, and that links with then stress, and we call it a bit of a domino effect, because if you're not sleeping well, you've got fatigue, it knocks on other symptoms, and then it knocks on stress and anxiety, and then maybe palpitations and brain fog. So it's a really important one, and there is so much we can do around sleep. So cognitive behavioral therapy is really effective at sleep. It's sort of that acknowledging our thoughts and our feelings. We wake up in the middle of the night, our brain kicks in, and we start thinking, oh God, tomorrow I've got a presentation to do, I'm going to be so tired. And it's that self-compassion that all of us wake at some point during the night. And if we can calm our nervous system down, maybe do some mindfulness, maybe do a body scan, and you'll fall back to sleep in time. Maybe I need to have, a bit more of a restful day tomorrow if I possibly can. Maybe I need to catch up on the weekend. It's those sort of things that we need to think about as well. But on my in my ebook, there's lots on sleep. And as somebody who struggled with sleep for many years, even before the menopause, because of being a nurse working night shifts, I was really impacted by insomnia. So, I've learned things like using the Calm Act, maybe Headspace, eye masks, dark room, cool room. A lot of night sweats wake up women in the perimenopause. So if you can keep the room cool, have a cold glass of water by your bed, there are things we can do to help ourselves sleep. But do you know what the biggest thing is? Our reaction to that moment in time when we wake at 3 a.m. and think we can't get to sleep. So anything we can do to stay calm.
Brilliant. And because I have polycystic ovaries. I've always had polycystic ovaries, so I'm curious about the menopause, particularly in relation to that, and also in relation to those little beards that women can acquire when they're older.
Yeah, that's linked with the androgens that we get, the natural androgens that we get. So you do notice, lots of ladies say thinning of the hair on their head, and then chinny chin chin, it's that sort of thing, isn't it? So so being aware of that, there are things we can do. There are some HRT that helps with that if some people are that. There are some medications that women can take. We've got to be aware that, yes, we laugh about it, a few hairs or thick hairs on the chin. For some women, it can be quite bad on their tummies, on their chest, on their faces. So, there's that aspect as well. But hair thinning, we look at zinc. Zinc is really important for hair loss. And, it's just one of those things that we go through as our hormones change. Yeah, it's a difficult one.
Oh, that's brilliant. Thank you so much, Katharine. I've learned so much on this call that I had no idea about, and I'm sure that any of the ladies who listen to it will get a lot from the conversation. So www.fluxstate, that's FLUXSTATE.co.uk.
Yes, that's my website, and you can find coaching there. My courses, I've got a CBT course starting in September, and I run that 3 times a year. And then we've also got the ebook on there, and also a link to the Facebook group, which is a private Facebook group called Fluxstate Menopause. And come and join us.
Fluxstate Menopause. So if they ask to join, they can ask to join through Facebook. Absolutely. They don't want to do the website. So just say something about, do you want to say anything about the CBT course?
Yes, absolutely. So it's a 6-week course. We work with a small group of women. There's usually 6 to 8 women. It's all virtually. It's 2 hours a week. And we talk about perceptions of menopause, our cultural paradigms around it and how that might affect. We also look at our thoughts and feelings about our symptoms that we're struggling with. There's some mindfulness aspects in there. We bring in some journaling. We look at our self-compassion and how we can do that. And one of the lovely things things is bringing women together and sharing their experiences so that you don't feel alone. And the impact of the course has been immense. It really has. The women I've had some women who had left work, not worked for 3 years because of their symptoms of the menopause, and they've just stepped back into employment. I've had women who can't take HRT because of breast cancer, and they're now feeling like they're in control. They know what their triggers are for hot flushes and night sweats. And then people who feel that they can really use things like paced breathing for their anxiety, and looking at sleep as well. So has really helped with their anxiety as well. So we cover a whole lot of things, but if you're interested, there's some information on my website, and reach out to me and let's talk and see whether the CBT might be an option for you.
Great. And you're Katharine, and it's Katharine.
That's right, Katharine Gale.
Gale. Yeah, lovely. Well, Katharine Gale, it's been lovely talking to you. Thank you so much for coming along and doing this. And I'll get the recording out as soon as I possibly can. So thank you so much.
My pleasure.